We all know that northeastern states are popular for their tourist spots and for having rich and spectacular biodiversity amongst other states. Its rich cultural and ethnic heritage and presence of flora are an appealing factor for an immense opportunity for Ayurveda and medical tourism. The 8 states of Northeast provide an opportunity for medical treatment in the region, which means adding a new life to healthcare services. In this context, the Ministry of Ayush is particularly working in close coordination with NEIAH to popularize the various forms of herbal practice and thus to create and propagate an awareness among the masses, mainly on Ayurveda wellness. Speaking to AIR News, Dr. Vishnu Chaudhary told us the Ayurveda system of medicine is long practiced in almost every household of the region. However, such knowledge and practices has remained confined only as traditional practices in the region. But Ministry of Ayush is operating all across the state and setting up new Ayurvedic institute to have more study in this field. Under the mission Ayush, the central government is working on the promotion of Ayurveda and propagating the awareness of Ayurvedic benefits amongst the people. Not only in COVID pandemic, the Ayurveda has a greater role in holistic wellness like curing diabetes, cough, fever and other ailments, he added.
Government of India, Ministry of Ayush, launched one mission, that is National Ayush Mission. Through this mission, they are providing healthcare all over the India. Huge number of doctors, Ayurvedic doctors and paramedical staff are serving under this scheme and providing healthcare in every corner of the country. And as the demand is increasing day by day, Ministry of Ayush plan to set up 12,500 Ayush Wellness Center across the country to cover the demand. So here also in different state, as you know, this health is a completely state matters. So many state governments, like you see the South Indian states, they are having very proactive and they are taking active role for promotion and propagation of Ayurveda. So in Northeast also this promotion is going on, though it is the initial state, but hope near future every household, the Ayurveda will reach every household and get the benefit.
Meghalaya is a hub of traditional herbal medicine. The tranquility of the place and its natural medicinal facilities would make the area an excellent wellness retreat for those looking to rejuvenate their body, mind, and soul. In this regard, wellness tourism aims to heal body and mind through Ayurveda therapies can be enormously developed using natural herbal ingredients. While interacting with Dr. Abhishek Bhattacharjee, head from Department of Panchakarma Neha, told us that amongst various Ayurvedic therapies, Panchakarma is one of the specific therapy mentioned in Ayurveda which is used for cleansing of body due to having wrong lifestyle or different food habits. Panchakarma therapies helps to detox the body and regenerate them. The therapy is quite popular in the region, and various international tourists from neighboring countries like Bangladesh, Myanmar, and Bhutan visit the Shillong for having Panchakarma massage and herbal treatments.
Ayurveda is Panchakarma therapy, and another very demanding therapy in Ayurveda is known as Kshar Shudra. That is actually surgical procedure which is in relation to the different anorectal procedure. But Panchakarma is a very specific system of therapy which has been mentioned in Ayurveda for the cleansing of the body as a whole. Okay, if we go for Panchakarma therapies, then that help to clean our body, whatever toxin substances, whatever impurities get deposited in our body due to our wrong lifestyle, wrong food habits, and nowadays you see we used to take different type of chemicals in terms of pesticides or in terms of fertilizer along with our food, and preservatives we take, so that get deposited in the body, and when we take different Panchakarma therapies, that helps us to eliminate the toxic substances what get deposited in different tissues of the body. So in Panchakarma therapy, if you see, actually Ayurveda as it is from Vedas, language is Sanskrit. So if you see the term Panchakarma, there are two basic terms. One is Pancha, one is Karma. Pancha means actually five and Karma means specific therapies. So there are basically five main therapies which are used to eliminate the impurities from the body, and along with those five actually there are different multiple therapies are there which help to rejuvenate the body.
During this pandemic, the rise of medicinal plant plantation is a rising factor for Meghalaya. In this regard, NEIAH is playing an important role in setup for retreat focused on herbal treatments, Ayurvedic therapies, yoga centers, etc. These retreats would employ as well as seek the advice of indigenous people who have exceptional knowledge about their old traditional medicines used for the purpose of rejuvenation and holistic healing. Later on, while speaking to Dr. Vishnu Chaudhary, we also came to know that Ayurvedic medicine have antiviral medicine properties to treat corona disease also. The institute have undertaken various clinical studies for the better outcome of corona prevention and cure.
We did training around 200 traditional healers, initial training. We are working on it. So we have given initial training so that they have to be aware about the different conditions. They are giving very good medicines. We have seen their proof also. But scientific validation required. Before that also we have given some initial training so that they will not mislead by, like you see this jaundice. One simple example I am giving. Jaundice may be only one symptoms. For them it is disease. But for us jaundice may be viral hepatitis, maybe liver cancer, or maybe your gallbladder stone. So treatment will be different. So what they have to choose, they have to know what they are giving. The scientific proof, what level this medicine is working. That is, we have to work. Means lots of potentiality is there of traditional medicines here in tribal medicines here in Shillong and Meghalaya. That we have to work on it.
Meghalaya still lags behind in health-related infrastructure when compared to other mainland states. Improvement of health infrastructure of hospitals and other complementary structure as well as the technology and skills are required. Skill shortage is the biggest barrier to the promotion of medical tourism in Northeast India. In the final comment, while speaking to Abhishek Bhattacharjee, Head Department of Panchakarma, he said that the role of Ayurveda has a huge role in making Kerala a medical tourism hub. Despite the fact Meghalaya has the potential and well blessed with natural herbs, we have to work on better health and the other infrastructure which is related to pay attention.
And we are developing ourselves to cater in a better way to the people who are coming from the state and also who are coming from outside the state and outside country also. And actually we were just planning to make our to talk with the state tourism department, but due to this COVID pandemic, this total procedure was in a pause now. But obviously, because the pandemic situation is resolving, and whenever we are open, we should try our level best to make this institution, because this is a national institution, and this is we'll try to make this hub to cater for the medical tourism in a better way in future.